Hi, my name is Alessandra Bice. I'm doing the medication administration video today. I don't have my skills kit yet or my badge yet, so we're using ibuprofen tablets and a shot glass as our measuring cup. We are going to start by verifying the provider's orders in the computer. I'm going to verify the 6 rights of medication administration, which are right medication, right patient, right dose, right time, right route, and right documentation. We're then going to check the medications in the EHR or the MAR, which is going to be Keflex 250 milligram tablet or capsule, a potassium chloride 20 MEQ tablet, a Prevacid 30 milligram capsule, Zolpidem 10 milligram capsule or tablet, and a Lotenzin 20 milligram tablet. We are then going to introduce ourselves to the patient. Hi, I'm Allie. I'm going to be your nurse. I am going to close the curtain to provide privacy. I'm going to verify the patient using 2 patient identifiers such as name and date of birth. What's your date of birth?
6/22/1998.
Okay, I'm then going to ask the patient if he has any allergies to medications or food or anything else.
I do not.
He has no allergies, so we're going to move on and do hand hygiene and perform or grab a clean set of gloves. We're then going to check the medications again in the MAR as a third check, and we're going to explain the medications and the side effects to the patient. So the patient is getting a Keflex 250 milligram capsule, which is an antibiotic. Side effects can be nausea, vomit, or diarrhea. Please let me know if you have any of those side effects. Next, the patient is getting a potassium chloride 20 MEQ tablet, which is a potassium supplement if the patient has low potassium. Side effects can be nausea, vomiting, or diarrhea. The next medication the patient is getting is a Prevacid 30 milligram capsule, which is for treatment of gastric ulcers. Any abdominal pain, nausea, vomiting, or diarrhea, please let me know. The next medication is the Zolpidem 10 milligram tablet, which is a sleep aid. Please let me know if you're feeling anxious or anything like that. And then the last medication is a Lotenzin 20 milligram tablet, which is a blood pressure medication. So I'm going to check the patient's blood pressure before I administer that medication. And side effects could be nausea, dizziness, lightheadedness. So please let me know if you have any of those side effects. And then the last medication that we're going to do is acetaminophen, 500 milligrams per 15 milliliters. And we're going to measure that by placing the label of the bottle into your palm so that it make sure the label doesn't get messed up. We're going to remove the cap, measure the liquid to 15 milliliters, since that is the dosage the patient is receiving. And then we're going to make sure to wipe the cap with a tissue before we recap it, or the lid of the bottle before we recap it. And then we're going to make sure the patient is sitting up in a proper position, has something to drink. You don't have to take that. And then we're going to give the patient some medications. He'd rather hold them in his hand, so he's going to do that. And then we'll let him take those medications first. You don't have to take them. And then we'll let him drink the liquid medication. Once we have ensured the patient has taken the medications, we are going to make sure the patient is in a comfortable position, his table and belongings are within reach, the call light is within reach, and they have no further needs. We're then going to remove our gloves, perform hand hygiene, and document that we gave the medications.